Hello and welcome back, our dear viewers, with our first distinguished guest, for our first distinguished guest, Dr. Mohamed Elkhouly. Welcome to the show. How are you doing so far? Of course, and our doctor, as you know, the term electric physiology is kind of new for a lot of people. They're not familiar with, but for you, of course, like something that you deep-rooted and you have studied about and you are familiar with. So far, in a very simple terms, what is the electric physiology to people who are not familiar with it?
This is a branch of cardiology dealing with cardiac electrical system. It is studies heartbeats, how it is originated and spread through the heart and lead to squeezing of blood from the heart to all the body. And the electrophysiology protect this system or dealing with this system and treats its abnormality or any disease including this system.
That's really interesting. And how does usually the system work in simple terms?
It is simple 4 steps.
There are 4 steps?
4 steps.
Okay.
First step is like starter. We have in our heart small tiny node called sinoatrial node or SA node. This is a starter of the heartbeats. It detects or determine how heartbeat will go. When this starter giving signal, the upper chambers of the heart will squeeze blood to the lower chamber. Second step is a small pause. This pause reaching the signal from the SA node or sinoatrial node to the atrioventricular node, second node, between the atrium and the ventricle. This pause will allow the blood to pool inside the ventricle. Third step is squeezing the blood.
Squeezing the blood? Squeezing
the blood through the signals spread all through around the ventricles and this ventricle squeeze blood to the whole body after that.
And that part happen externally, right?
Internally.
Internally. Okay.
So we have a starter, then short pause, there squeezing, then repeat. This process will repeat again and again all the day.
All the system again and again?
Yes.
Okay, interesting. And of course, on daily basis, you have different problems that people come with, regarding the heartbeats and the rhythm itself. What are the most common ones?
Most common ones, people complaining of 3 different symptoms. Maybe fast heartbeats, maybe slow heartbeats, or irregular heartbeats. The fast, like racing heart. You feel the heartbeats is too fast. This reflected by palpitation, some shortness of breath, some chest pain, or you feel some slow heartbeats. This reflects to the patient by some dizziness, fainting attack, maybe loss of conscious, or irregularity in heartbeats, some skipped beats. Feel like the heart is not organized in its pulsing process. So they may reflect the patient by palpitation but irregular or skipped beats.
And usually what are the causes for patient to endure such failures?
There is multi-factors can cause this to the patients. Maybe disease within the electrical system itself, disease in the metabolism of the patient, or some medication he is taking from outside, or some structural disease in the heart muscle or heart valves, maybe some inflammation, pericarditis or myocarditis.
And could it be inherently, from one of your family members?
Yes.
Within the family itself?
Yes, some diseases through, going through the families by genetic process, like Brugada syndrome or some long QT syndrome, This is يعني runs through the family, and يعني you will diagnose it by some investigation to the patient, including genetic tests.
Like when it comes to the investigation, is it like a one-time session or is it like a multiple sessions?
No, يعني there is a multiple tools to investigate these diseases. Simplest is electrocardiography اللي هو ECG.
Okay.
If it is يعني recurrent and easy, you can diagnose within 10 seconds doing ECG during the attack. But if the attack is intermittent, you need more tests like long-standing Holter ECG, like loop recorders, like internal loop recorders. This implanted inside the body, but lasts for a long time.
Of course. And sometimes, like, you know, when patients go to a doctor to see them when they're having like some illnesses or suffering some sort of illnesses, it's kind of hard for them. They are usually worried about like what the doctor gonna discuss or what they gonna reveal to them. So how can you like maintain a calm pace for the patient and help them understand their condition without them like being exaggerating the situation?
يعني always we explain to them this is يعني not dangerous disease in most of the cases, and diagnosis now is very easy, and the management is يعني very simple. Can be by simple medicine or can be by intervention, simple intervention, not like before open heart or like this. No. Simple
medications can help them overcome it.
Yes, medication can help them in simple cases like escaped beats or premature atrial contraction, premature ventricular contraction, or even lifestyle modification can help them.
And regarding like a lifestyle, how can we differentiate between like a regular heartbeat and irregular heartbeat?
This, as I told before, simple tests, the electrocardiography or ECG, can differentiate very easy.
Like for example, when some people at home, you know, sometimes like they do a lot of exercise, working out, and they have like this heartbeat, which is normal. But sometimes they are just sitting, enjoying their time, and all of a sudden the heartbeat may be like increasing faster.
Yes.
So when it like we should be concerned?
It is يعني if it is not يعني induced by stress or anxiety or bad sleep rhythm, suddenly during rest, this يعني tells the patient you should investigate yourself. You should go to the doctor and do some investigation to the heart or blood tests, simple blood tests to see what is happening during rest, why I have this palpitation.
And could sometimes like anxiety or stress or sleep disorder affect the electrical heartbeats rhythm?
Yeah, very much.
In
very
which
much
way?
So, because this anxiety and stress and bad sleep rhythm, it modificates our circulation. The adrenaline level will increase. This adrenaline is very sensitive to increase the heart rate and increase sensitivity of the heart muscle to be more fast. Also, the sleep rhythm, if very bad, there is disturbance between parasympathetic and sympathetic nervous system of the body. This will increase also to increase the heart rate. Also, decreasing oxygen during sleep. Some disease called obstructive sleep apnea. This may cause hypoxia. Hypoxia will cause more bradycardia to the patient.
Making the situation even worse.
Yes, and he should treat this the cause to treat the electrical problem.
Okay, that's good to know. And sometimes like people, you know, they associate heart failures or like heart electrical disorder with only like older people. Could that also like affect young people as well?
يعني this is يعني combined يعني
factors,
yes.
Like age plays
the
important role?
age increase diseases of the electrical system. Most of arrhythmia, especially atrial fibrillation, more common in the older patients. And also bradyarrhythmia, more common in older patients because more comorbidities, hypertension, diabetes, ischemic heart disease, this affect the muscle and by time affecting also the electrical
system. So when we say like age, is that because of like the normal lifestyle for people around that age period,
yes,
where they're just relaxing, they just don't do like as much activity as they used to do before?
Yes.
For example, if there were like someone, let's say like around maybe 60s or in his 70s, but during that time he was really active, doing a lot of exercises, and he's really in a good shape. Would that also like age be a factor here, or because he was doing like sport that could help them like in a better way?
Yes, the better lifestyle giving him better heart, better electrical system, good health, strong muscle of the heart. But also I wanted to highlight the young people is not immune, because they are taking a lot now of power drinks and vapes, and this also can cause electrical problem to the heart, especially drinks of like energy, and like this is not healthy to the electrical system of the heart. Also, some diseases, some inherited diseases are common in young patients, like Wolff-Parkinson-White syndrome, like long QT syndrome. This can happen in younger age.
Younger age.
Yes.
And that's very like a good point that you have mentioned here, which is like energy drinks. Unfortunately, we have lost a lot of like a quite number of people in their younger ages just because they were taking like excessive drink of energy. Yeah. And now thanks to the Ministry of Interior for prohibiting, and the Ministry of Commercial for prohibiting like the use of energy drink within like a specific age.
Yes, this is very good decision, because the young age always using this drinks by not normal
period of time.
Per day, they are using so much, and this affects
they are treating energy drinks as they were having
tea
soda
or coffee, yes.
or tea or coffee, making their heartbeat not only go faster but go like an insane amount of beating at the same time. That's really interesting to know, and a very good point for all parents and also like the younger generation who are watching us through this program, to be worried about energy drink consumption so they can have a better life and a better lifestyle in the future. And sometimes like we talk about like the diagnosis for electrical heart rhythm.
Yes.
In terms of like the heart problem, what kind of test that we use here?
There is numbers of tests you can diagnose the electrical abnormality. As I said before, ECG, Holter, event recorder. This event recorder is very intelligent. It can diagnose in the time of attack.
The time of attendance?
Yes.
Like quick?
We give the patient small device. When he has the attack within 2 weeks, this device can last recording more than 1 week. Once he has the attack, he puts the device on the side of his heart and just press a button. It will record the rhythm.
And it gives like an
accurate diagnosis.
Accurate.
Yes.
That's interesting.
Also, there is some general investigation about the structure of the heart, like echocardiography, like cardiac MRI. Some invasive tests, we can do it in the unclear diagnosis case, like electrophysiological study.
Of course.
I will go with a small needle from the groin, and a tiny catheter will go to the heart and will map the electrical system of the heart.
And then given like an accurate
diagnosis and mapping the site, and we can remove this pathology easy by small ablation using radio frequency. And the most recent, we can use more safe
applications to diagnose in a better way. That's definitely like shows how the technology have helped like in improving the diagnosis system and make it even better within a short of time. All thanks and appreciation to our guest, Dr. Mohamed Elkhouly, for being here and informing us about this interesting topic and how we can have a better lifestyle. All thanks and appreciation.
Thank you very much. Thank you.
And now, dear viewers, we're going to take a quick break and then we're going to be back, so stay tuned.